everyone. Welcome to SALVY'S Podcast, a podcast where we'll teach you, equip you, and empower you with the knowledge that you should know about, the knowledge that you can apply and use to save your life, the life of your neighbors, the life of everyone around you. Today's topic is going to be centered on kidney diseases, kidney failure precisely, and this kidney failure is on increase, but many do not know about it, especially the young youth. It has affected them because of their lifestyle habit and their poor knowledge about it. The kidney plays a vital role in maintaining the body's internal regulation, and yet many people do not know about it. So that's why we have some good guests who will be teaching us about this sweet topic. So by my right, I have...
Right, listen guys, my name is Comrade Bengaso David, one-time SH Director of Health of St. Anthony's College of Nursing. I'm a nursing student. Thank you.
Thank you, sir.
My name is Chima Grace Chibozo. I'm a student nurse.
Thank you, ma'am. So today, let's dive into this topic about kidney failure. But before we move into this kidney failure, we need to know what the kidney is. So, sir, please can you tell us about the kidney?
Alright, the kidney is a bean-shaped organ that is located posteriorly behind the abdomen. It has specific functions of filtering waste from the blood. It also has the function of regulating hormonal balance. It also have another function of helping to increase red blood cell production. These are the few major functions of the kidney. Thank you.
So, sir, does it really mean that the actual work of the kidney is to eliminate waste?
Yeah, because if you come to the bloodstream, if you study the lymphatic system, you notice that there are there are waste products in the blood. So the kidney serves as a filter to eliminate this in the blood and cause a good blood flow. Thank you.
Thank you so much. So, Nurse Gracious, I would like to know, are there medical or lifestyles that can actually predispose someone to have these kidney failures?
Okay, renal failure, which can develop gradually or suddenly. Here are some common causes: hypertension, which tends to destroy the renal blood vessels; diabetes mellitus, excessive sugar destroys the renal filtering unit; prolonged misuse of medications, especially pain relief; kidney infections or untreated urinary tract infections.
Wow, thank you so much. So let's say, in this part of the world where we're not in, you see people taking some concussions and engage so muchly in self-medications. Do we say that the self-medication has an effect on this renal system?
Of course, too much exposure to harmful substances can tend to damage the renal functions.
Wow, thank you so much. So now we would like to know, actually, sir, are there some signs and symptoms that one can see and say that, okay, this is a renal case or renal failure?
Yeah, so about that, there are visible signs that can denote the presence of renal failure. For example, you have swelling of the legs and the ankle, that's edema, right? When you notice that your legs and your ankles are swollen, it means there's a deformity in your renal system. And then you also have general weakness and body fatigue. When your body does not seem to, bring out adequate urinary output, you know that there's a renal inflammation. And then you also have difficulty in breathing. When the body system does not have a proper circulation, it does something bad to the system because you cannot aspirate as you're supposed to. So these are notable signs of renal failure. Thank you.
Wow, thank you so much. So, considering about the seriousness of these kidney diseases, is there any preventive measures that we should engage in?
Of course, some of the preventive measures include regular medical checkup, checking your blood pressure and sugar level, maintaining adequate hydration, reduction in high salt intake, lifestyle modification, limiting in high alcohol consumption, and quitting smoking.
And also regular body checkups to denote, right? Prior to, if you feel abstract stains in your body, I think you should go for
last but not least, maintain a good body weight.
Wow, thank you so much. I believe if we should engage in this preventive measures, it will really help us to control the effects of this kidney disease. Now we are going to talk about the issue of management awareness. So, is there anything we can do when this kidney disease becomes severe?
All right. At advanced stage, the patient is required to go for some medical interventions, which include dialysis or a kidney transplant to help elongate the lifespan of such patient. So it will play a very vital role in helping manage the patient as a whole. Thank you.
Wow. That means dialysis is also something that you can prescribe for someone to go and do. Thank you so much, actually. Now, there is something that is bothering me, actually, because people have been commenting about this, telling me no salvation. We have been hearing that this thing is happening. So I want us to clear this mind about this. I want to ask this question. Is this kidney failures majorly for elderly people?
The answer is no, right? Because any individual in particular can have a renal failure. It happens in adults, and then it happens also in youth. Even a child can have a renal failure due to birth disorders and all of that. These people too can have renal failure due to past lives of being addictive smokers or drunkards. And then youths too, they can have renal failure due to injuries or a lifestyle that do complicate their livers and all of that.
Wow. Thank you so much, sir, about that answer, because people really need to know that it's not only elderly people that suffers it, even young people. Thank you. So, most gracious, people do take herbals for it. Is this herbals actually safe?
No, my answer to that is false, because for the mixture, we don't know the contents of that herbal. And secondly, some of these herbals are being prepared in such unhygienic ways, which is not good for human consumption.
Okay, thank you so much. Meaning that if you are an abo drinker, if you are in the party of herbal cook, please, it's necessary that you should stop it, because you don't know the actual content of it. Okay, now I want to know, can this disease actually be silenced without someone knowing that he's having this disease?
Yes, renal failure can be asymptomatic because certain individuals they are so ignorant that they don't notice the changes in their body. So you might really be going through some stuff and then you don't know. So it's asymptomatic. But then I think for medical students and then people that are inclined in the healthcare services, they notice every change that their body makes, and then they do proper health checkup and screenings to make sure that their health is in check. Thank you.
And also, the kidney being a vital organ that works involuntarily, individual can harm it without them knowing.
Wow.
So the effects can increase without time and destroy the vital functions of it.
Wow, thank you so much. In fact, I'm impressed at you guys' explanation. You guys have really done a good job by telling us and everyone around about this kidney disease. So, sir, I would like to know, is there any final word of advice that you can give to our audience so that they can know how to take care of themselves?
Right, I'm going to actually drop to right. I will advise you to live a healthy lifestyle to protect your kidney.
Okay, my last advice is that since we have talked about kidney failure being asymptomatic, never you wait for the symptoms to show. Always go for medical screening and checkup.
Wow. Thank you so much for this honorable advice. And let me tell you, my viewers, kidney issues can be preventable. You can actually prevent it. The kidney works constantly in your body. It does not stop functioning. So make sure you try to avoid things that can trigger it. And please, in case this is your first time of watching us, this is SALVY'S World Vocals. Do well to subscribe, like, share, comment. Thank you so much.
Thank you, everyone.